Hello, I'm Dr. Richard Eastwood, GP at Windrush Practice. Thank you for replying to my text message inviting you to a low carbohydrate diet diabetes reversal clinic. It's something I'm trying to set up as a completely additional service. It's not something that we would normally be doing. It's something that I'm doing because I believe in it and I've made a bit of time to try and do it. But I have to say the response to my text message has been really quite overwhelming. I've had over 200 people reply to say yes please, and it's kind of blown me away really. Most GPs who try and do this, and a few have around the country, find that actually the problem is motivating patients to try. Well, I've got the opposite problem here. I've got too many of you. So I'm having to change my approach from a simple clinic to perhaps something a bit more remote. I don't know yet. It depends on the final numbers. So I thought if I could explain a little bit more about what it means. Some of you may decide, actually, no, that is not for me, and then you don't need to continue. But if you're still interested, then you can reply to the text message that I sent to invite you to watch this clip and say, yes, please, I'm still interested, something like that. And we'll see how many numbers we've got. So what I'm proposing is to see you in a clinic of some description, take a few measurements, do some blood tests and see where we are at the start, and then to guide you onto a low carbohydrate diet. Now that's a diet which means you eat fewer sugars, including natural sugars in fruit and so on, but very importantly that we massively reduce the amount of starchy carbohydrates that you're eating, including things like pasta and bread, potatoes, pastry, anything that's got flour in it really. These foods are really just sugar in a different name. If you look at them molecularly, they're just sugar molecules all joined together. And when you eat them, they get broken down into their smaller sugar components. That goes into your bloodstream and up goes your blood sugar. So it's very logical. You stop eating the sugar foods and your sugars come down. In fact, more than that, what seems to happen is when you stop eating these foods is that the fat which is built up in and around your liver and your pancreas, which is actually now we think what causes type 2 diabetes, starts to disappear. And it does it within a few weeks, and then over the course of a few months it really gets back to normal, and your diabetes starts to go into reverse. Now, what does that mean? Well, people who've done this find that approximately half of them become effectively not diabetic any longer. That means their blood sugars are in a normal range, as if they didn't have diabetes. And they are no longer needing to take any diabetic medication, and don't have any of the risks that comes with diabetes, including long-term risks of heart disease, stroke, kidney and eye problems, and so on. The other half of people who don't quite get to that point, they all really see a very large improvement in their blood sugars, and most will be able to stop some diabetes medications or reduce the dose or just continue in that direction. Those statistics come from about a 2-year point, but really improvements are seen within a few months. People also, by the way, lose on average 1.5 stone of weight, that's 9 kilograms, without changing or doing any more exercise, just by changing the diet. So it's a long-term job. It's actually a lifelong change to what you eat, and that's a very important point to understand. If you were to do this and then 2-3 years later you were to go back to eating as you are now, then actually the diabetes would come back, and you would probably then need to go back onto the medication if you're taking any at the minute. So that's something to get your head around, that this is a change forever, and if that still interests you, I'd be very keen to try and help you with it. I think the benefits can be enormous. Very important point, please do not start to do this yet, particularly if you are taking any diabetes medications, because some of those drugs actually are dangerous if you stop eating carbohydrates. You find that your blood sugars will go down too far. You can become hypoglycemic, which is, of course, very dangerous. And there are some other dangerous problems that can happen. So please just don't start, but reply to the message to say, I'm still interested. And as I said before, I'll look up how many numbers we've got and scratch my head a bit and work out how on earth we can go forward. But I think it's quite exciting, and I hope to hear from you soon. Thank you.